Good morning, Gulf News, and welcome back to Zahra Hospital, Dubai. Today we'll be talking to you about a very important health matter. It is a silent killer and the #1 cause of death in the world amongst both men and women, and that is heart disease. More specifically, we'll be talking to you about heart attacks. And joining us today is the team at the Heart Attack Center at Zahra Hospital, Dubai. They'll be talking to us about different signs and symptoms of heart attacks. Why is it important to go to a specialized facility if you're experiencing one, and what is life like after such a traumatizing experience? So without further delay, let's go in and meet them. Good morning, gentlemen. How are you today? Thank you so much for meeting us. This is Gulf News. Thank you so much for your time.
Good morning, Gulf News. I'm very happy that you could come and cover our services, what we are doing, and to know what is being done in Heart Attack Center at Zahra Hospital. And I am head of cardiology here, Dr. Rajiv Lochan, and we have a full-time team who runs this cardiac center 24/7. We do heart attack patients care, and we have a team of 3 interventional cardiologists. And with me today we have Dr. Behra Elahi.
Good morning, Gulf News. You're most welcome. And I'm Dr. Behra Elahi, interventional cardiologist, as a part of the team here in Zahra, Dubai.
Thank you so much for the introduction, gentlemen. How are you this morning?
We are fine.
All right. We won't take very long. I know you have very busy schedules. So we'll jump right to it. Heart disease and heart attacks are a very common health problem worldwide. How prevalent is heart disease in the UAE, Dr. Lochan, from your experience here?
So according to WHO figures, the 40% is the incidence in UAE for the heart attack patients, and roughly 22% patients die because of the heart disease. So it is a very, very alarming situation, and we have to take care of that, and this is our concern.
Okay. And also, Dr. Lochan, what are some of the forms of heart disease that you tend to see at the Heart Attack Center?
So basically, it's the heart attack and some arrhythmia or heart failure. These are the major areas which we deal with, apart from some other valvular or structural heart disease, what we call like aortic valve disease or mitral valve disease. But commonest remains is the heart attack, and which is the major killer.
And you said in heart attack, the mortality rate is 22%?
That's correct.
What does that mean?
It means that patients which are coming with a heart attack, in spite of all the treatment, they can still lose their life. Up to 22% of the patients, they can lose their life in spite of the good treatment. If they don't get a treatment in time, more than that number will be affected and lose their life.
Okay. Now, what sort of medical interventions are available at the Zahra Hospital, Dubai, at the cardiology department and the Heart Attack Center, Dr. Behra?
I think the best treatment and the best medication is, first of all, is the lifestyle changes. It's better to prevent to have a heart attack or just prevent to have a blockage in the heart vessels, okay? And we have so many measures that we can do to prevent the heart problem. Like, for example, if you have a healthy lifestyle, like a good pressure control, you control your blood sugar very well, and you just have a healthy diet, and your weight and exercise, everything will optimize and well controlled, then the risk of and chance of having a heart problem is very less, okay? But in the medical side, if we think about the medication, of course, the medication for the blood pressure, for the blood sugar, everything is available, hopefully in UAE, and even a newer generation of the medicine that including some injection that reduce the cholesterol maybe up to 90%, also here available in UAE that we can use them.
Interesting. And in terms of medical interventions, for example, if someone does come through with a heart attack or any kind of critical conditions, what are some of the measures that we take here in terms of interventions?
Here in Zahra Dubai Hospital, we have a protocol for the heart attack. When the patients come to the emergency room, within the 15 minutes, we activate our protocols, including the activation of the cath lab and activating the team to take care of the patient, okay? And by the way, we have all the facility, not for only common procedure that routinely is doing for elective cases, and also we have a best brand of the stents and balloon that's routinely used in the common procedure. But beyond that level, we have so many other tools that for the very complex cases that we can use to just have a very good result even after the procedure and in the long term for the patient. Because here in Dubai, usually the age of having a heart attack usually is 10 years earlier than if you compare to the Western countries.
Oh wow, that's a very interesting figure. And would you say that's predominantly allocated to lifestyle, or is it more of a genetic factor, or is it a mix of both?
Well, just to add on that, mainly that we have much larger number of the younger workforce in Middle East. That's the one major cause. Second is the stressful life. Most of the people are working long hours, they're mentally very challenged, and they have much higher incidence in addition to genetic. As we all know that in Asian countries there is a higher incidence of severe coronary artery disease, like in people in India or coming from neighboring countries. They have a very high incidence, and these people have MI at much younger age. As Dr. Behrad has mentioned clearly, that 10 years is definite that period, and sometimes we have seen youngest period age patient of 22 years having heart attack. So they are the changing pattern or scenario of the heart attack.
That's very interesting. In the case where someone is undergoing a heart attack or is experiencing a heart attack, how does immediate and high standard care can make a difference in the outcome of a patient that's going through that?
See, for example, at our heart attack center, we have standardized the protocol, and what we are doing, we are trying to open the artery. As we know, the heart attack happens when the artery gets totally blocked. And if the artery gets totally blocked, the heart muscle dies out within hours. So we have to take action very fast, and our aim is to open the artery within 90 minutes. Interestingly, most of our patients, we have been able to achieve less than 90 minutes. Last patient which we did, it was in 62 minutes. So I think we are getting much quicker as compared to some of the Western countries. Probably we have a smaller country, the patients reaches little early, and we are able to activate our system very fast, which is the most important thing. And our team is very, very ready for it. And they live close to the hospital, so everything starts very quickly as soon as things are activated.
Thank you very much, Dr. Lochan. In terms of, Dr. Behrad, in terms of state-of-the-art facilities and technology, what are some of the facilities that we have here that support you with the interventional cases?
It's a very good question. Actually, here in Zahra Hospital, Dubai, in our cath lab, we have a facility like Ultravascular Ultrasound. Okay, that is a micro catheter. It's a very small catheter. It's a device that we put in the vessel of the heart, and exactly we can measure the size of the blockade, the length of the blockade, and also sometimes the mechanism, what is the reason that the patient have a blockage. Okay, this is the IVUS that already is available in our cath lab. And also we have some other tools like, for example, FFR, that we can measure the pressure, before and after the blockage in the heart vessels. Okay, and sometimes if the pressure is not drops, then after that, if the pressure doesn't drop, that means the patient doesn't need revascularization. Even in the presence of, for example, if by your eye estimation, the blockage is more than 80%, but if the pressure before and after the lesion is fine, then you don't need to put a stent in the patient unnecessarily. And also we have a facility for the CTO, that is a chronic occlusion. For example, if some patient has a blockage in the heart vessel for many years, more than 15 years, and if the blockage is like a stone, it's a very calcified lesion, it's like a stone, we have a tools like, for example, diamond-shaped catheter that rotated with a speed of maybe around 200,000 beats per minute that can drill the blockage and open the vessel. We have all the facility here in Zahra Hospital. It depends on the case, and we can use it accordingly. But hopefully we have a heart team here. That means this is not a decision that takes only by me or by Dr. Loshan. When we have a complex cases, all interventionists and also radiologists and the cardiologists involved in the case, and then we discuss about the case to see what approach is the best for the patient.
Just to add on to the same thing, we have recently started a new technique which we call lithotripsy, and this lithotripsy is something which we commonly use in the kidney stone breaking. So the technology, we have advanced catheter which has got a lithotripsy attached to the balloon catheter, and it goes in the very calcified hard blockage of the arteries, and that we can open it easily with this new technique, and it helps to open the artery and get a better result. In long term, it is much better to have this kind of facilities with us.
Thank you very much, Dr. Loshan. You also mentioned something about a case that you've recently done. There was a very complex case.
Yes. So this is a young chap, reasonably around 40 years of age, came in early morning hours with chest pain, and he was thinking it was a lower chest pain and abdominal pain. He thought it is a abdominal pain and gas, and he didn't do anything to do with the heart, and he ignored it for 1 or 2 hours. So he came 2 hours late to the hospital to get a heart treatment. And as soon as we realized that he come to the unit and emergency room, they did a ECG. It was circulated to our team urgently, and we found it needs urgent care to open the artery. So we came and opened the blocked artery. While we are shifting the patient to the catheter, he developed ventricular tachycardia, which is a very fast heart rate. And these patients do die suddenly if no action is taken within a short time. So this was happening, and then with this immediate treatment, and after that the balloon artery was opened and patient improved immediately. So this has been a drastic experience, important experience, and according to these facilities which we have also applied for JCI accreditation of AMI Center, or Acute Myocardial Infarction Center, which we have got the accreditation, and I believe this is the first center in Gulf countries to have this center, and we are proud that we are able to maintain that standard because they keep a very strict control, check on our situation. All the partners, all the team players, they have to individually screened and scrutinized for the quality of care, and we have been able to clear that, which has been a great achievement for us. We are very happy for Zahra Hospital.
Thank you very much. Dr. Behrad, quick question regarding heart attacks. What are some of the initial, symptoms or initial points that people should look out for? For example, if somebody goes to the doctor and gets a bunch of blood tests done and the cholesterol level is high, what is the correlation, or what are some of the things that people should watch out for that could predict, a possible heart attack in future?
Actually, heart attack is something acute happen for the patient. That means patients come to the emergency room or just have, even in the home, he have some discomfort in the chest, okay? And usually it's not presented like a chest pain. Sometimes it's a very vague pain or discomfort in the middle of the chest. And sometimes the people think because the heart is in the left, then the pain should be on the left side. But this is not proper, okay? Sometimes it's in the middle of the chest. It should be in the middle of the chest, okay? And it depends on the age of the patient and the risk factor. Some of the patients, they have a diabetes. And the diabetic patients, sometimes they do not have any pain at all. They come with only sweating or just sometimes with the abdominal pain. And especially in the ladies, in the woman, we have a very atypical presentation of the heart attack. For example, in the young woman, even there is no pain. Maybe they come with a back pain or the neck pain. Because of that, when we have any symptoms from the jaw up to the abdomen, first we should rule out the cardiac problem, especially the acute coronary syndrome, that is an acute heart attack. Then after that, we should rule out the other differential diagnosis.
Thank you very much for that. So in the case where someone is suspecting that they might be going through a heart attack, what is the first thing they should do?
If they know, if they think this is something wrong happens for the heart, they have a chest discomfort, they have alarm symptoms, first of all, I think they should call the ambulance, okay? They should not come by their own to the hospital, and ask them to take them to the hospital, who have a 24 hours, 7 days available with the cath lab facility, And that is I think this is and the ambulance should bring the patient to the hospital with all the equipment if it's necessary to open the vessel of the heart as soon as possible. And as Dr. Loshan previously said, the time is muscle. Okay, that means our goal is not just opening the blockage in the heart vessels, because by the time the one thing that we lose is the muscle of the heart. It's not and when the muscle dies, we cannot do anything for that. We don't have any treatment to make the dead tissue again to be alive. Okay, this is our goal.
Thank you very much, Dr. Lochan. Is it possible for patients that are going through heart attacks to go back to normal life as they have before the heart attack?
Yes, I think that's a very, very important point. And we do have patients in my follow-up, those who are after heart attack, they are going jogging, walking about 6-7 kilometers, which is fantastic result. And we have a approach. We call these patients in a group to encourage and meet each other, to understand, exchange what they have done. To the younger patients and other newer patients, those who are many times feel very depressed after the heart attack, and they come to know that others, they have gone back to their full life, which is very, very important. And majority of the patient, heart has got a lot of capability to recover. Nature has given us lot of improvement which can be done, for example, by exercise, by timely treatment and preventive approaches, which are important, like taking care of blood pressure, like taking care of cholesterol, regular exercise, walking and jogging. This all improves in lifestyle. So I think another point which we should have as a all, ourselves and for our friends, we should remember that we should have a high suspicion of index. If somebody is having chest discomfort, abdominal discomfort, it could be heart. It may not be heart, that's all right, but it's important to come to the hospital in emergency. Sometimes very easily it is advisable to take a tablet of aspirin. Aspirin helps to cause the thinning of the blood. Many times it opens up the artery before the patient reaches the hospital, to the hospital till that time. So it improves the results of our angioplasty if it comes to the hospital. And I think it's very, very important that timely treatment should be taken. Nitrate has been another tablet which has been applied. Sublingual nitrates have been given or a spray. It helps to relieve the pain. But aspirin as such is much better in opening or thinning of the blood and opening the artery, which has got longer lasting effect on our long-term results.
Thank you very much, Dr. Lochan. Now, considering that heart attacks are usually silent in the sense that you don't really see them coming until it's very, very late, what is some of your advice that you can give to patients for prevention in terms of maybe screening or getting regular checks on the status of your heart?
See, this is very important that as we are growing through a stressful life, younger people, and as we mentioned, are getting more heart attack than in the past. So we should start having a regular checkup. For example, after the age of 30, if you have a family history, one should be very careful that roughly 25 to 30% of the offspring of the parents, those who have a heart problem, are likely or can have a heart attack or heart problem. So they have to take care of cholesterol, blood pressure, sugar if they have, and timely check. And the time to time should come to the cardiologist, a regular physician who will do a exercise test and some echo tests, some blood tests. And these are can predict the problems at early stage. I had one patient on a routine checkup found to have a treadmill test positive. When we did an angiogram, we found his 3 arteries were blocked. And he ended up doing a bypass surgery, and he was surprised, and so we were, because he didn't have any symptoms. He was just doing a regular job. He was a mechanical engineer and in the airlines, and he was so surprised to see all this, what his all 3 arteries are blocked. In a detailed investigation, we found both of his parents had a heart disease at earlier age. So this is one of the risk factors where we have to be very careful and take our routine checkup like once or twice a year, depending upon the doctor's or cardiologist advice.
More of a personal question. What was the youngest patient you've ever seen having a heart attack?
Youngest patient I had was 19 years.
Oh wow,
That's the very, very shocking that at 19 years somebody can get a heart attack. But I found within a 6 months, his brother came to me. He was 22 years. And both were very active. They used to play badminton. And then we found out this family history was a very strong link. And their father also had a heart problem. So I think some of them have a familial link and some have other risk factors like diabetes or blood pressure, obesity. Physical inactivity is the most important provocating factor of the heart disease. So I think all these things are important to be attended.
Thank you very much. Dr. Behrad, if somebody above a certain age, for example, I don't know, say 50 years old, decides to start a rigorous exercising program with lots of cardio, do you recommend that they check with a doctor before they start doing so?
What the guideline recommended is that if the patient is more than 40 and he has other risk factors like diabetes, for sure he must check with the cardiologist, just do a basic investigation like sometimes some non-invasive test like a treadmill test or just the echocardiogram to be sure the cardiac was fine if they want to go for the professional exercise, okay? By the way, if the patient doesn't have symptoms at all, that means he's just walking, he's athletic, he's doing a regular exercise, and he doesn't have any cardiac risk factors, including the cholesterol, sugar, diabetes, hypertension, then I think they can continue if they want to go for the non-professional exercise. But if they want to be, for example, participate in the marathon or just running 17 kilometers, for sure I recommend that they should come and check, yes.
And are smokers at a higher risk factor?
Of course, the smoker is one of the major risk factors for the heart attack. These people who are smoking have a heart attack at a younger age, okay? Minimum is 5 to 10 years younger than the normal population. And quit of smoking is one of the most prognostic factors. If someone can quit smoking, the longevity and the survival of this kind of patient is much, much more better than the normal patient, yeah.
Thank you very, very much, gentlemen. The information you have provided for us was extremely helpful. Thanks a lot. We'll let you go back to your busy schedules and helping out patients. And we hope to see you very, very soon.
Thank you very much, Gulf News, for taking this time for this important information. And because one of the important things which we have learned is the public education. Public at large, if they are aware what is happening to their health, it is the most important thing media can do, at least disseminate this vital information and can save a lot of lives. Thank you very much, Gulf News and Al Zahra team.
Thank you very much.
Thank you, Gulf News, for coming. Thank you.
Thank you. Have a good one. Thank you.